The patient is a male in his 8th decade of life with a history of throat cancer treated with radiation and neck dissection. The patient also suffers from trismus, severe cervical spinal stenosis, and coronary artery disease. Recently, the patient underwent esophageal dilatation with awake airway management. On presentation for redilatation, preoperative endoscopy reveals a normal-appearing larynx, and routine intravenous induction of general anesthesia and intubation using a flexible intubation scope was undertaken.